Hey, this is pharmacist Curtis Alexander. In this video, I want to talk about the side effects from Ropinirole, and I'm going to use the name Requip. Requip is the brand name. It's just easier to say, so that's what I'll talk about moving forward, but it is Ropinirole. So a couple things to keep in mind. Requip is used because it's a dopamine agonist. That means it accentuates or acts like dopamine, and that's great in stuff like Parkinson's disease, because one of the theories is that Parkinson's disease is due to a drop off in dopamine in certain parts of the brain. So the idea is to get that dopamine up. But when you do that, it comes with a wide host of side effects. So you're going to see Requip or Ropinirole used in a couple of conditions: Parkinson's, which I just mentioned, also restless leg syndrome. So the side effects are the major ones I think you should look out for. They aren't in any particular order, because the side effects occur more in restless legs or more in Parkinson's, kind of depend on the side effect. But it's a good overview, and it's a discussion you can have with your doctor. So just starting out, the first one is augmentation, and like the name implies, it's actually augmenting the restless leg symptoms. It's not common, but it can occur in up to 4% of patients, and we don't know exactly why it's happened. The theory is that, again, it's a dopamine agonist. It's a dopamine agonist for multiple dopamine receptors. You don't just have one type of receptor. There's multiple types of dopamine receptors. So we think it has something to do with hitting the dopamine 1 receptor more than the dopamine 2. We don't know for sure, but the big thing is augmentation. So it can cause those restless leg syndrome or symptoms actually to occur earlier on, which is obviously not what we want to have happen. The other thing that can happen, this is fairly common, I've seen this before, is impulse control. This can be a problem with people who gamble. It can also be a problem with hypersexuality. I've seen this in people who are taking it in nursing homes or assisted livings. And it can become a problem, especially in that population. So we tend to see it the most in folks who are being treated for Parkinson's disease. Part of the reason is the doses we're using for that. It's a wide range, anywhere from 2.6 to 34.8% of people. So again, if it's somebody who has had a gambling issue in the past, this is a medication we'd want to be careful about using. The next one, very common, very, very common, is nausea and vomiting. Again, this is dose related, and this is completely related to the dopamine side effects in the body. Nausea can occur in up to 40 to 60% of people, so it's very common. Vomiting 10 to 12%. If you want to get into the why behind this, I talked about some more of this, why this occurs, in the video I did about Cinnamon. But again, dopamine in the periphery of your body will cause nausea at a very high rate. So something to keep an eye out for. Next is orthostatic hypotension. It basically means if somebody's sitting down, they go to standing, their blood pressure sees a rapid drop and they run the risk of passing out. So not real good idea on occurrence on this. Obviously, it's just something to keep an eye out for. So monitor blood pressures. If you're living with somebody who's taken Requip, keep an eye on them and these sorts of symptoms. Next is sleep attacks, hypersomnolence. Basically what that means, and this can be rapid, where the person gets very fatigued, very sleepy very quickly. And obviously, if somebody's driving, those sorts of things, it becomes a concern. DAWS. This is the last one I want to mention. DAWS stands for Dopamine Agonist Withdrawal Syndrome. Okay, and what we see is that if you start Requip or Ropinirole, you have to start it at a very low dose, and then we move it up very slowly. And the same occurs if somebody stops it. You don't want to stop Requip abruptly. You want to come down off it slowly, because if you don't, this dopamine agonist withdrawal syndrome can show up anxiety, depression, insomnia, flushing, the nausea and vomiting we talked about, and the fatigue. We see this a lot in Parkinson's folks, again, because of the high doses we use with that, 15 to 19% of people. In this video, I shared what I feel like are not only the major side effects to watch out for, but some of the more troublesome side effects. If you have any questions, post them in the comments. I really appreciate you letting me know other videos you might want to see. My whole goal with doing these is to make sure they're valuable for you. So please let me know in the comments. Also let me know by liking and subscribing to the channel. But again, if you post in the comments, I promise to read them. I can't always reply to all of them, but any ideas for future videos are always appreciated. So I hope this video was helpful, and until the next one, this is Curtis Alexander. Thank you.